Minister Reti, thank you. Have you seen any evidence that heated tobacco products are safer than cigarettes?
I have not, but it is not in my purview anyway. My focus is on committing to the health targets and making sure New Zealanders get better health outcomes. To that effect, Minister Costello has the lead and she has our support.
Do you think, though, that heated tobacco products could be a gateway for people to take up cigarettes?
That's actually for Minister Costello and the advice that she receives to make a decision on. She's been supported by Cabinet collectively, and we're all committed to driving down smoking rates.
Minister Reti, do you have confidence in Health NZ's leadership given the cost blowout?
I absolutely have confidence in Health New Zealand leadership, particularly since substantively the cost blowout was in the hands of the previous team.
This deficit has arisen under your issue. This happened after you came into government. Did you take your eye off the ball? Do you have any responsibility for this situation?
I think the fact that I appointed a Crown Observer within 3 or 4 weeks.
Do you have thoughts on what's the role of private capital when it comes to, potentially investing in public health assets, for example?
We're very open to that. We're very open to public-private partnerships in the building of critical health infrastructure. It'll work in some cases, it won't work in others, but it's on a case-by-case basis.
Have you been talking to, people in the finance industry or about what shape that could take, potential?
Just our new government wants to get infrastructure built. We have a massive infrastructure deficit, whether it's on schools, whether it's in health, hospitals, whether it's on roads, and as you know, we're open to new and different funding and financing tools.
And what kind of, going back to these public-private partnerships, what model do you see that taking? You're talking about, private investors perhaps building a hospital and leasing it back to the Crown? Or?
There's all sorts of mechanisms. If you go, there's no one model that fits. It's not right for every project. But again, on a case-by-case basis, which is what our National Infrastructure Agency will be assessing, we've got to get the right funding and financing mechanism in place for a Three Waters investment, for a hospital investment, for a roading investment, and make sure that we've got the right partner, the right mechanism, the right construct for the project that it actually is. So it's not a...
How reliant is the public healthcare system on the private healthcare system? You mentioned, operations are being done in the private system and always have been, but I wonder if maybe you could paint a picture of what is the situation at the moment in terms of how much the public system is...
I'll let Shane talk to that, yeah. Thank you. Just over 10% of our elective procedures are completed in private at the moment.
Right. And how does that compare historically?
Look, it's mostly plateaued. I think a very small increase over time, like over a decade, but mostly plateaued at around about 10 to 12%.
And how do you see that changing in the future? Do you expect it to maintain that?
Look, as the Prime Minister said, we're very interested in entertaining collaborations with private where we can utilise capacity that they may have, that we may be able to purchase.